Department of Social Welfare, Government of Nagaland Pra, Aji Kohimadi, International Day Against Drug Abuse and Illicit Trafficking observed Krisha. Program laga special guest do MLN Advisor Department of Social Welfare, Wangbang Kunyak Pra Kushagi, drug abuse do individual problem eklan nahoy, huilibi public health, economic productivity, aro regional security di tangwar katra rakete. State to international border routes lot usur daka karne geographically vulnerable daka janai gina wangbang bragushige younger generations kan substance dependency ra bish effect wigina se aro ito karne sorgar laga top priority do drug abuse kilaf larai kura se. State sorgar ra war on drugs declare kura reiterate kurikina assert kurishige sorgar laga efforts eklabra drugs crisis address kuribali naparibo. Kintu addiction heal kuriboledo strong community support aro compassion lage. Wangbangbra sub churches kanki counseling units panabole non-judgmental support promote kuribole aro recovery groups host kuribole pinti krushe. Program this because kanbra state day drugs kas kurigna sunflower istimal kura parigina ja upper concern otaisha ro drug free Nagaland nimide kam kuribole committed taka reaffirm krisha. Details saisabo.
It is an honor to join you on the occasion of the International Day Against Drug Abuse and Illicit Trafficking. This day reminds us that the challenge of substance abuse is not merely a law enforcement issue. It is a public health concern, a social development issue, a family issue, and above all, a human issue. Today, as we align our thoughts with the national vision of Nasha Mukt Bharat Abhiyan, Viksit Bharat Ke Pehchan, we recognize a fundamental truth. A developed India, Viksit Bharat, cannot be realized without a drug-free India, Nasha Mukt Bharat. Our youth are our greatest strength, and shielding them from the clutches of addiction is the very identity of our progress. Dwelling on the global theme, world drug problem, persisting issues, new challenges, and innovative responses. Let us reflect on these three realities through both a national lens and our unique context here in Nagaland. Despite decades of intervention, drug abuse continues to devastate individuals, families, and communities. Addiction remains a major cause of poor health, family breakdown, crime, lost productivity, and social exclusion. Here in Nagaland, our geographical proximity to the Golden Triangle, international drug trafficking corridor, has historically made our borders highly vulnerable to the influx of illicit narcotics. For decades, our communities have borne the heavy burden of substance abuse, which has stolen the potential of generations of young Nagas. Recovery does not end when a detox cycle finishes. Individuals overcoming addiction need concrete opportunities for skill development, specialized vocational training, employment, and genuine social acceptance. The fight against drug abuse is not a battle that can be won by governments or the police department alone. It requires the unwavering commitment of every single sector of society. Let us replace paralyzing stigma with active compassion, blind punishment with strategic rehabilitation, and self-indifference with immediate action. Let us empower the youth of Nagaland with knowledge, sustainable livelihood opportunities, and genuine hope. Let us support the families who are quietly struggling and the villages that are striving to protect their future. Let us reaffirm our commitment to the vision of Nasha Mukt Bharat Abhiyan. Let us prove that a vibrant, developed Nagaland and a Viksit Bharat is defined by healthy, thriving and drug-free citizens who live with dignity and purpose. On this International Day Against Drug Abuse and Illicit Trafficking, let us move forward with fierce determination, local innovation, and powerful partnership. Let us remember, prevention is possible, treatment works, and recovery is absolutely achievable. I wish all the panelists and the participants here that the three panel sessions will be a very enriching session for all of us. Thank you. God bless.
Give me this opportunity to express my concern and highlight some of the present trend as far as addiction in our state is concerned. Let me begin by proudly announcing to all of you that just a week ago, I celebrated my 23rd year of clean and sober life from addiction. Free from alcohol, free from addiction. And I'm proud to be standing here in front of all of you, beautiful people, in front of everyone who stands committed to work together to help my friends who are still suffering. So I bring greetings to all of you also on behalf of not only N. Nagadao, but also on behalf of all the drug users across our state. Having said that, challenges still persist, new challenges continue to emerge, and for quite some time, we as NGOs, we were worried because since then, way back the early 80s, the addiction has had its effect on our society. And we believe that the sufferings were not immediate, but what harms have been done during those years, we are suffering only during this period. We have lost a whole lot of bright, brilliant, hardworking youth and productive members of our generation to addiction in the 80s. Now, when I recall my addiction, 5 of my friends were shot dead. Many died of overdose. Some landed in jails. Some dropped out of schools, college, including me. But I was able to continue my study after recovery again. But during those years, that was the dreaded period, the horrors of addiction. And literally, no one of us, even the government, nor the civil society organizations, were having a concrete and a good strategy to address this menace of addiction in our state. But today, we have scientific tools, we have evidence, and those evidence are clear that treatment works. And I stand here to also prove and testify that treatment really works. Addiction is a disease. Addiction is a disease, and it is not me saying it. It is the American Medical Association saying it after a thorough research way back 1956. They came to the conclusion that it is a disease, and 2 years down the line, the World Health Organization has endorsed that yes, what American Medical Association's finding based out of that research was which stated that addiction is a disease. Yes, it really is a disease, and that has also been endorsed by the World Health Organization in the year 1958. Now, given that situation, I'm also seeing that there's a whole need of things that we need to do. Some are very practical, some are involves a process, but I want to impress upon the Ministry of Social Justice and Empowerment to also expedite on the need to expand its rehabilitation centers in Nagaland. Yes, no doubt, the social welfare of department and all we have been cooperating, collaborating, and working together for many years. But despite that, challenges still continue, and I feel that there is also a shortage of rehab center even for the male drug users. But more importantly, my concern also is being drawn to the female drug users, because there is no specific female rehab center for them specifically being run by the government. We have maybe 1, 2, or handful being run by some church or private organizations, but if the government can initiate that. Now, just to conclude, I want to also reiterate by saying that addiction being a disease, it's a compulsive disease, it's a progressive disease, it's a chronic disease, and it's not a curable disease, but still the good news is that it's a treatable disease. But a relapsing, it's a treatable disease because it's a relapsing disorder again. So people post-recovery, like me, or many of the other friends who are struggling to sustain their recovery also, need continued support from all of you. With that, I conclude. Thank you.
The theme for this year, the world truck problems, persisting issues, new challenges, innovative responses, strike the very heart of modern reality. The old, predictable threats of traditional narcotics have mutated. Today we face a complex frontier of highly addictive synthetic drugs and sophisticated technology-driven trafficking, cartels that infiltrate our towns and villages right through the smartphones in our general's hand. This day serves to remind us that drug abuse is not just an individual failure. It is a systematic threat to public health, economic productivity, and regional security. Let us look closely at our home, Nagaland. Due to our proximity to the international border routes, our beautiful state has long been a vulnerable transit corridor and an unfortunate destination for illicit trafficking. Generations of our brilliant youth, the very spine of our future, have been silently consumed by the trap of substance dependency. The central government, through its flagship nationwide movement, the Nasha Mukht Bharat Abhiyan, has recognized that the punitive, law and order only approach is insufficient. Under the vision of the Viksit Bharat, the focus has drastically shifted towards institutional demand reduction, grassroots counseling, data-driven mapping of the vulnerable hotspots, and dignified rehabilitation. In alignment with the center, the Nagaland state government conducts massive awareness programs across the state through the district level Nasha Mukht Bharat Abhiyan committee headed by the commissioners by the deputy commissioners. Law enforcement agencies have done a commendable job in recent times in curbing the supply of illicit trafficking of drugs. The state government is also committed to strengthening mechanisms to enforce the Narcotic Drugs and Psychotropic Substances Act, tightening border monitoring and increasing the number of de-addiction centers in the state. The state government declared war on drugs to save future generations from the menace of substance abuse. However, law enforcement and state mechanism alone cannot win this very war. The police can intercept a shipment at a checkpoint, and the courts can penalize a dealer, but the state cannot monitor what happens inside every closed bedroom, nor can a law patch up a broken heart or a broken home. This brings me to core of my message today. In Nagaland, our social fabric is beautifully unique, and our community and a faith-based organization, especially the church, can influence and play impactful roles. Therefore, my appeal to our respected church leaders present here: you hold a moral authority and an emotional gateway into Nagaland's home that no government office can ever replicate. If there is a place where hope can conquer despair, it is within the sanctuary of the church. For too long, societal stigma has pushed addict into isolation, treating addictions as a moral crime rather than a chronic medical illness. We must pivot. I urge our churches to look past the pulpit and build active, institutional, and compassionate interventions. Let us leave this hall today with a very firm commitment. We will not look away. We will protect our borders. We will clean up our streets. We will resource our rehab facilities, and most importantly, we will hold the hands of our struggling youth with fierce love and zero judgment. Let us pledge today to build an empowered youth and an addiction-free Nagaland. In conclusion, I want to wish and I hope that the panel discussions will be very productive, a very educating and interactive sessions which is coming ahead. Thank you so much and God bless.
Today, we unite under the Nashamuk Bharat Abhiyan. So let us all together take a firm decision to make our state Nagaland drug-free.
This Suposhit Gram Panchayat Abhiyan is not related to drugs. However, we felt this would be the right platform to give this very prestigious award. It is the first time that the state, the department is giving such an award to a village. And I'd like to give a brief background of what this award is all about, because I'm sure quite a few of you are confused about this. So, officially, this Suposhit Gram Panchayat Abhiyan was launched by our Prime Minister Shri Narendra Modi on the 26th of December 2024. And it's a grassroots initiative by the Ministry of Women and Child Development Department. So we extend our appreciation to the ministry also for starting this campaign. Now, its core objective is to accelerate progress towards a malnutrition-free India by incentivizing village councils to improve health infrastructure, community mobilization, and nutritional outcomes for vulnerable groups. So it is like this. Nationwide, all over India, 1,000 Gram Panchayats are selected. And for us, in our context, it will be the village council. They will receive an incentive grant of rupees 1 lakh. which is strategically allocated to foster long-term rural health improvements. Now, the criteria to be nominated and to qualify for this award is not an easy feat. There are certain criteria. So the performance metrics is measured through the Poshan Tracker application. And for those who are new to the Poshan Tracker, it is a digital tool developed by the Ministry of Women and Child to track Anganwadi, each and every Anganwadi center all over the nation, and its specific purpose is to ensure last mile delivery of services to our beneficiaries. So the criteria is like this. Firstly, Anganwadi center must be functional for at least 21 days per month. That's the first criteria. Another criteria is a minimum of 50 registered beneficiaries. And for us, our beneficiaries are our pregnant women, lactating mothers, and children aged between 0 to 6 years. So every panchayat, every Anganwadi center under a particular village council should have that number. And they should also have 90% growth measurement efficiency, with at least 80% of the Anganwadi centers having drinking water facility and 70% functional toilets. And ministry is also very specific about this amount, this award, this incentive that is given to the village council. They have also made the breakup for the utilization of the award. So 25% goes directly to the Anganwadi workers and helpers as a reward for their service. They are our frontline workers. And 25% will be dedicated to community mobilization and increasing local beneficiary enrollment. 50% is to be invested by the village, which is inclusive of the council, the villagers, and our workers, the department people, to invest in nutrition-focused Anganwadi center activities. So I proudly declare that in Nagaland also we have a village who qualified. It is not easy, like I mentioned earlier, who has qualified and has deservingly won the award of this Suposhit Gram Panchayat Abhiyan. So the village is none other than Mima village, with a total population as per our Anganwadi baseline survey, with a total population of 2,300, with 1,165 male and 1,135 females. So total household is around 443, and we have 4 Anganwadi centers under that village. So total beneficiaries as of today is 157, out of which another very good thing is their Aadhaar verification is 156. So only one is less, and we hope that single number will also be traced out. Sir, I would like to request you to kindly give the award to the village council and the Anganwadi workers who are present here today.